Hey guys, welcome to sppharmaexplainer YouTube channel. You may notice under zerodol brand name, so many different medicines comes in the market, mostly in tablet forms, such as zerodol, zerodol P, zerodol S, zerodol SP, and zerodol PT. In this video, you will be able to fully understand about the ingredients, on what condition, which medicine should be used, dosage and everything. So watch the video till end. At first, we will see about zerodol medicine. Its main ingredients aceclofenac, that is used to reduce pain. It is a NSAID, that is non-steroidal anti-inflammatory drug. So, whenever you see a zerodol medicine, you should know it is aceclofenac. It is used in joint pain, muscle pain, inflammation, redness and swelling. Talk about the dosage. An adult can take 325 to 650 mg per day, 3 to 4 times in a day. But it should be taken at 6 hours gap. All these medicines should be taken with doctor's prescription. Our next tablet is zerodol P. Its main salt are aceclofenac and paracetamol. It is used in back pain, muscle pain, throat and ear pain, and also you can use it in slight fever. The dosage is for adult is same here, 325 to 650 mg per day. You can see the picture here. You can take 2 to 3 times in a single day, but at a 6 hours gap. Now we will see about zerodol S tablet. It is made up of aceclofenac and serotonin. This tablet is used for inflammation, rheumatoid arthritis, back pain and muscle pain. The dosage remains same for this tablet also. You can see the zerodol S tablets image here. So next tablet is zerodol SP. Here SP is serotonin and paracetamol with normal aceclofenac salt. It is used in severe pain with fever, muscle pain and joint pain, pain with injury with slight fever, inflammation, etc. For adult, it should be taken 325 to 650 mg per day, 2 to 3 times at a 6 hour gap. Here you can see the picture of zerodol SP tablet. Last but not the least is zerodol PT tablet. It is a strong painkiller because it contains tramadol with aceclofenac and paracetamol. It is mainly used in severe body pain with slight fever. In an adult, it should be given 325 to 650 mg per day at a 6 hours gap in 2 to 3 times per day. For children, all these tablets should be given under doctor's prescription. Zerodol PT picture you can see this side. So that much for today. See you in the next video.